Today we're going to be talking about the effects of a low FODMAP diet on improving IBS symptoms. So first off, we're going to talk a little bit about what irritable bowel syndrome is, otherwise known as IBS. IBS is a chronic functional gastrointestinal disorder. It is characterized by bloating or distension, abdominal pain, and altered bowel movement patterns. The exact cause of IBS is unknown. However, some factors that play a role are weak intestinal muscle contractions, poor signals to the digestive tract, bacterial overgrowth, and changes in the gut microbiome. The main trigger for worsening IBS symptoms is certain types of food that depends from person to person. Next up, we're going to be talking about what the low FODMAP diet includes. FODMAP stands for fermented oligosaccharide, disaccharide, monosaccharide, and polyol. This diet includes 3 phases, the first being a restriction phase lasting 4 to 8 weeks, where FODMAP foods are completely taken out of the diet. It is followed by a reintroduction phase lasting 6 to 8 weeks, where some FODMAP foods are reincorporated into the diet in small amounts, and a personalization phase, where FODMAP foods that are tolerated are returned to the diet completely. Foods low in FODMAPs contain minimal amounts of fermentable carbohydrates that can trigger digestive symptoms. Here, we have a brief overview of foods to avoid in the diet and foods that you can enjoy. As you can see, the foods that you should avoid have excess fructose, lactose, fructans, polyols, and galactans. And foods that you can enjoy are fruits without a lot of fructose, vegetables with low fructans, starches, and dairy that is lactose free, as well as some other miscellaneous foods. So you may be wondering, why is nutrition so important in controlling IBS symptoms? Well, long-lasting symptoms from IBS have been linked to poor quality of life and missed activities due to uncomfortable pain, as well as mood changes, such as experiencing depression or anxiety. As there is no clear genetic factor, many people have turned to food and diet as a holistic way of treating and managing symptoms. So next, we're going to be looking at some research-based evidence supporting the low FODMAP diet. The first research article we're going to be looking at is titled Low FODMAP Diet Relieves Visceral Hypersensitivity and is associated with changes in colonic microcirculation in water avoidance mice model. So this experiment is an animal model experimental trial using mice, where adult mice were raised to establish an IBS-like model using chronic water avoidant stress. The mice were randomly divided into 4 groups and fed a custom-made diet, those being the regular FODMAP, high FODMAP, medium FODMAP, and low FODMAP diet for 14 days. The results showed that those fed the high, medium, or regular FODMAP diet had decreased colonic microcirculation blood flow, increased VEGF protein expression, and aggravation of visceral hypersensitivity. So we're going to take a minute to talk about some definitions of the words I just used. So visceral hypersensitivity is a lower than normal threshold for pain in the internal organs, where normal organ function can cause pain. And colonic microcirculation is the movement of blood through vessels delivering oxygen and nutrients and supporting the GI tract's ability to digest and absorb. So it was found that the FODMAP foods aggravate visceral hypersensitivity by increasing water volume in the small intestine and gas production in the colon, leading to abdominal distension. The mice given the low FODMAP diet had an increase in blood perfusion and reduced levels of VEGF protein expression, which is considered an inflammatory marker that can affect vascular permeability. High levels of VEGF cause mucosal inflammation that worsen IBS symptoms. Overall, it was found that the higher the diet was in FODMAPs, the less efficient the ability to digest and absorb was, as well as those processes causing more pain to the animal. The next study we're going to be examining is titled Low FODMAP Diet for the management of irritable bowel syndrome in remission of IBD. This is an observational study with a 6-week intervention. A total of 200 patients, 65 of which were diagnosed with IBS, followed a low FODMAP diet for 6 weeks. Anthropometric measures such as BMI and waist to hip circumference, lab tests, and lactulose hydrogen breath tests were performed to evaluate for the presence of SIBO. The results showed that after the intervention, 66.1% of patients reported no IBS-like symptoms, improved gut symptoms of flatulence and diarrhea, and no effect on the occurrence of constipation. The effectiveness of the diet intervention in the IBS group with and without SIBO did not differ significantly, showing it can relieve symptoms regardless of the coexistence of bacterial overgrowth. At the end of the study, 15.3% of patients reported diarrhea compared to the original 42.4%. At the end of the study, 27.1% reported flatulence compared to the original 94.9%, and 8.5% reported constipation at the end compared to the original 13.6%. As you can see in the picture in the top right corner, in every group and subgroup, the presence of no IBS-like symptoms at the end of the study was greater than the presence of IBS symptoms, showing that the intervention helped to decrease symptoms in more patients than not. The final study we are going to be examining is titled Improved Symptom Profiles and Minimal Inflation in IBSD Patients Undergoing a Long-Term Low FODMAP Diet, a Lipidomic Perspective. This is an interventional study with testing and observational symptom assessment. Diet intervention on 20 IBS patients ranging in age from 18 to 65 underwent a 90-day personalized program. They had initial exams and a completion of questionnaires regarding their symptoms, along with blood tests, stool tests, and other data to analyze specific markers. After the intervention, individual items such as abdominal pain, intensity and frequency, abdominal distension, dissatisfaction with bowel habits, stool frequency, and general interference with life all significantly reduced. In addition, there was a decrease in weight, BMI, and abdominal and waist circumference, most likely due to the more restrictive nature and lower calorie amounts during the elimination phase. Specific inflammatory markers also decreased, such as cholesterol, triglyceride, and fatty acids. The figure in the top right corner is showing the total IBS symptom severity scale scores. The figure on the left shows when the diet was first put into place, and as we can see, the severity of the symptoms were much higher, almost ranging to severe, but within moderate and severe range. At the end, during the final study visit after the intervention, we can see that the severity decreased very highly, with severity scores ranging between mild and moderate. Now we're going to be moving on to some conclusions, talking about, is the low FODMAP diet the best method for managing IBS symptoms? Is it for everyone? And how to learn more about where to start. Based on current research, the low FODMAP diet is considered to be the most effective way to manage IBS symptoms. Collective research has found that it reduced symptoms in up to 86% of people. Since there is no cure for IBS, diet is the best answer to managing symptoms, as certain foods can be a trigger for certain symptoms. My opinion, as someone who was diagnosed with SIBO almost a year ago, I went through antibiotic treatments twice and have been using food as a way to manage my symptoms. And the use of the low FODMAP diet was extremely helpful in understanding what foods cause worsening symptoms. Considerations. Consult with a dietitian before starting to ensure that you understand the entirety of the diet and each of the specific steps. Consider meal planning ahead of time and researching recipes, as change can be difficult and a lot of the foods to avoid can be part of a normal diet for some people. And most importantly, log your symptoms after eating meals to figure out what foods may cause distress, so you know in the future what foods you should be avoiding and what foods are safe for you. Next steps. First, if you are struggling with IBS or SIBO, consider consulting with your doctor to learn more about the low FODMAP diet. And some things I think would be important for the next steps in order to understand more about how the low FODMAP diet affects us, present and in the future, would be to have more research into how the diet impacts the diversity of the gut microbiome and inflammatory markers, and also a long-term, large sample size randomized control trial is extremely important to understand the positive and negative effects over a longer period of time implementing the diet. Thank you, and I hope you enjoyed.